Hello, I'm Bruce Browner. I'm the co-editor of Musculoskeletal Emergencies. It's a relatively new book published by Elsevier. And my co-editor is Robert Fuller, who is an emergency medicine doctor. I'm an orthopedic trauma surgeon. And the genesis of this book is that I'm the editor of a large 2-volume fracture text. And I became aware, my text is in the 4th edition, we're working on the 5th edition, and it became very obvious to me that neither my text or the other text, similar text, covers the treatment of musculoskeletal emergencies in detail. So we thought there was a gap, and that this gap is a problem for all the providers in the emergency departments, both in the U.S. and globally. There are many musculoskeletal emergencies which include not only fractures and dislocations, but open wounds, soft tissue injuries, infections, arthritis, compartment syndromes, things of that sort. So there's a whole array of musculoskeletal emergencies, none of which is really covered in these large fracture textbooks, nor is there another book which covers this subject. So the idea was that these problems are faced by emergency room physicians, and these are practicing physicians, trainees, and their mid-level providers, nurse practitioners, nurses, physicians' assistants, as well as orthopedic providers, which means orthopedic surgeons in practice and in training, and their physicians' assistants and nurse practitioners. So none of these people who are facing this large body of problems, some studies estimate that 1/3 of doctor-patient interactions in primary care and in the emergency department revolve around the musculoskeletal system, and yet there's no really good reference that guides these providers through the treatment of the diagnosis and treatment of these problems. So that was the background on the book, and we thought that the book would be best created by co-editors, one being an orthopedic surgeon, the other being a practicing emergency medicine physician, and then we recruited writing teams that were composed in each case of orthopedic surgeons and emergency medicine doctors, and in some cases we brought in other specialists from internal medicine, radiology, etc. to cover other subjects. But the general concept was to have people in those specialties write the book for people training and practicing in the specialty. I think that, the whole genesis of the book, as I spoke about earlier, was that the fracture textbooks take the patient almost right into the operating room. There's some limited discussion about what you do during the diagnostic phase, but what is very clear in the developing world is that there's much more reliance on closed fracture management, wound management, management of burns, management of infections. So these things which occur in the austere environment are basically covered, because we're covering what you do in the emergency department. In many cases, that's very common to a developed country which has good resources, and a poor country or a disaster environment which has an austere environment. The book was written not only in a print version, but designed to be put into electronic version. So it's available on as an e-book on tablet-type devices, and it also has a website. So it can be accessed either as an e-book, as a contained item, and through the web. And the book is gained the attention of the American College of Emergency Physicians, and they are selling it through their online bookstore as well, which is a recognition of the value of the book, because there's no other similar book that addresses these very common problems. The videos that we have are comprehensive in the sense that they discuss the problem, they discuss the diagnostic maneuvers that are necessary, and then they go on and discuss the treatment.